Hi, I'm Dr. David Chapman. I'm a board-certified gastroenterologist, and I'm here to speak to you about your upcoming colonoscopy. I'm sure you have some idea about what is involved, and you may have even had one before. Perhaps it has been a few years, so I will explain the procedure as if this is your first time. The colonoscopy procedure is pretty straightforward. After administering a strong intravenous sedative, we insert a long, thin colonoscope into your rectum and advance it all the way to the top of your colon. The scope is about 6 feet long and the diameter of my index finger. We then slowly withdraw the scope and examine your colon for possible polyps, colitis, tumors, or other abnormalities. We do colonoscopies for 2 reasons. A diagnostic colonoscopy is for someone who is having a clinical problem like chronic diarrhea, change in bowel habits, anemia, or bleeding. We do a screening colonoscopy for healthy adults 50 years and older to find and remove asymptomatic precancerous polyps and prevent colon cancer. For those with a family history of colon polyps, we begin screening before age 50. Screening colonoscopies are usually covered as preventative care by Medicare and most health insurance plans. For an average risk person, the National Institute of Health recommends a screening colonoscopy every 10 years. About 26% of healthy 50-year-olds will have 1 or more polyps. An average person has about a 5% lifetime risk of developing colon cancer. Screening colonoscopy can dramatically reduce this risk. Polyps can be quickly and safely removed with a colonoscope. The polyp specimen is then sent to the lab for analysis. I can usually tell before the biopsy if the polyp is benign or malignant by its appearance. I still ask you to call me in 1 week for the biopsy report. Colonoscopy is one of the safest of medical procedures. While no procedure is 100% safe, colonoscopy is more than 99.9% safe. The primary risks are perforation, bleeding, or reaction to an anesthetic. We take great care to keep it safe for you. The colonoscopy takes about 30 minutes. You then spend about 20 minutes in the recovery area before going home. You will need a driver to take you home. Since the colonoscopy procedure is so short, your driver should remain in the GI lab while you are having your procedure. Your driver should be someone I can speak with afterwards. I will speak with you also, and you will seem alert. There is, however, an amnesic effect to the sedative. Your driver will remember what I said to you about your procedure. You may not. Even though you will feel fine, you are not permitted to operate a motor vehicle for 24 hours after a colonoscopy because the residual effects of sedation can slow your reflexes. When you arrive home, you will be hungry, but I recommend you eat a small, soft, bland lunch, about half of what you would normally want to eat. If you eat too much too fast, you could become nauseated. In preparation for your colonoscopy, you must take a large volume of laxative called a prep. You have likely heard bad jokes about colonoscopy preps from your friends who have suffered through them. There are several commercial preps on the market, and I have personally tried most of them. Patients find that taking my prep is a surprisingly pleasant experience compared to the horror stories they hear from their friends. My prep consists of Ducalax tablets followed by Clearlax, water, and Crystal Light lemonade for flavoring. I selected this prep because it is simple, cheap, safe, and tasty, or at least palatable. I actually took it for my own colonoscopy before offering it to my patients. Your palate thinks you're drinking lemonade. Your bowels know better, so stay close to home during your prep. Read the detailed prep instructions at least 3 days before your colonoscopy. They tell you what to eat, what to drink, how much, what medicines you may or may not take, and how to take the prep. I have tried to anticipate and answer any questions. However, if I have missed one, my phone number is also on the instruction sheet. In order to make your prep experience easier and more convenient, I've arranged with Linda Vista Pharmacy, located on the corner of Baston Cherry and Rose Drive, to sell the prep as a kit with detailed instructions. They buy the ingredients in bulk and pass along the discount to you, selling it cheaper than you can find it elsewhere. They also carry the Ensure you will need for your morning nourishment before starting the prep. I recommend that you drink 3 cans of Ensure before noon, as you will be on clear liquids only after noon. We ask that you start drinking the lemonade solution about 14 hours before your actual procedure. Follow the printed schedule. If you develop nausea or bloating, you may stop and rest for 1 hour to let your stomach empty. Then resume the prep. There is a 4-hour break built in, and then you resume the lemonade solution. We include this break for a good reason. We realize that you could complete the prep by midnight and get a better night's sleep. This, however, would result in a poor prep. We want you to complete the prep 6 to 8 hours before your procedure. You then can drink only clear water until 4 hours before your procedure. You should have nothing by mouth after that. Please do not try to rush the prep and finish it the night before. Your intestine begins to manufacture more stool the moment you stop taking the prep. This happens even though you are not eating food. Stool is brown, and I cannot see through it. Your diarrhea should be clear, transparent, or yellow tinged. If there is residual brown stool in your colon, I could miss a serious lesion like a polyp or cancer. There are 2 bottles of Clearlax in the kit. Some people are able to completely clear out with the first bottle. Most people are not. If there is any doubt as to whether your prep is complete, crack open the second bottle. Follow the printed instructions. I encourage you to err on the side of taking too much prep rather than not enough. Be sure to take your routine morning medications with a small amount of water 4 hours before your scheduled procedure. Take no diabetes pills for a full day before your colonoscopy. Let us know if you are on blood thinners. Let us know if you are an insulin-dependent diabetic, so we may adjust your dose. Good luck on your colonoscopy prep. Please call us if you have any questions.